World Malaria Day is observed annually on 25th April to bring global attention to the efforts being made to end malaria and bring about a change to eradicate malaria completely. The WHO has noted impressive gains by India in their fight against malaria. According to its report, most malaria prevention campaigns were able to move forward this year without any delays in spite of the COVID-19 pandemic. India recorded the largest reduction in malaria cases in Southeast Asia from 2000 to 2019. India has contributed to the largest drop in cases nationwide from 20 million to 6 million. In spite of the outstanding achievement by India in case of it, strict intervention is needed to eradicate malaria completely from India to zero cases. At Medicircle, we are conducting a series on malaria with eminent doctors for World Malaria Day to boost awareness and educate people about the preventions from it. Hi, this is Sana Khan, and today in this initiative, we are going to speak to Dr. Ketan Mehta. Dr. Ketan Mehta is an experienced consultant physician, cardiopulmonologist, and diabetologist based in Mumbai, who has been practicing for the last 2 decades. He consults at the Health Harmony Clinic in Malad, as well as at a number of reputed hospitals in the western suburbs, such as Suchak Hospital, Asian Heart Institute, among others. Dr. Mehta has an MD in medicine and is a fellow of several medical associations. Please welcome Dr. Ketan Mehta to Medicircle. How are you, Dr. Ketan?
Thank you, Sana. Thanks for inviting me. I'm very fine and hope you and all family and our listeners all are in a safe place right now.
Thank you so much, sir. Very well, fine. Okay, so Dr. Mehta, to begin with, how is malaria transmitted?
Okay, so now I think that's the very basic question, and I'm sure by this time all our listeners must have heard time and again. So it is, everybody knows that mosquito is the culprit. But we must remember, mosquito is not the one which is causing malaria. So it is basically, malaria is caused by the parasite, what is called as, which is Plasmodium species. No, we will not go into the technical stuff. But the mosquito bite, whenever the mosquito bites a person who is infected and sucks the blood from that infected person, which carries this parasite, and then this mosquito bites another person where they inject that infected blood and can cause. So basically, the mosquito is nothing but a courier person,
Right.
Carries the infection from one infected person to another person. So it is a parasite-borne disease transmitted by mosquito, and which is Anopheles mosquitoes, and which is commonly bites a person at night time. Thank you.
Okay. So, Dr. Mehta, what are the do's and don'ts in this malaria?
Fine. So now you rightly said the first and very important points we should be taking care is about the hygienic practices in and around it. If a person has got malaria, at least he should try to see to it that there are no mosquitoes around. So he needs to keep his surroundings neat and clean,
Right.
so that there are no mosquitoes come. Otherwise, he would be a danger for other people in the society. So
Correct.
that is one very important thing he has to take care. Now, secondly, he has to take care of himself whenever there are symptoms suggestive of malaria. I'm sure if you have seen any single person in your family, surroundings, relatives with malaria, you will able to identify, he will develop a severe shivering and ripers. The body will start shaking,
Right.
and he will feel like number of blankets to be used.
Right.
So if he gets, it's a very strong suspicion, and whenever somebody gets it, he should consult his family physician or a nearby primary healthcare center or hospital, because many a times people take it, oh, this must be some routine fever, and takes one simple tablet of paracetamol or any other painkiller, which is most dangerous. So that is another thing. Second, whenever somebody is suspecting of malaria, there will be a poor appetite and intake would be really low. And that can really hamper. In fact, whenever somebody has malaria, if your appetite is down, don't worry, go on consuming liquid. My very important message would be over here. Whenever you are having a fever, any febrile illness or a fever like malaria, you should be consuming at least 50 ml per kg body weight within 24 hours. So say for example, if you are 60 kg, it is 60 into 50, so 3000 ml, that is 3 liters of liquid in 24 hours. So hydration is the most crucial factor. Please go on sipping whatever form of liquids you can have, it be in plain water, be it electrolyte powder, be it coconut water, be it tang. So you can drink whatever liquid, but your hydration status should be well met. Third things which should be avoided is because malaria is one entity which can affect various organ systems in the body, especially liver, which is commonly involved. So they should avoid consuming anything which is heavy on digestion. So first is non-veg food should be avoided during malaria. Foods which are heavy on digestion like oily, butter, cheese, these are the stuff we need to avoid during malaria. So these are the few precautions a person should keep it. So diet, intake, physical activity. There should be obviously restriction of physical activity because these are the time when they will get easily fatigued. So they need to restrict their physical activities. If a person is having underlying any medical illness, say for example, high blood pressure or high blood sugar, they need to keep a check on it because if a patient of diabetes gets malaria, their sugar levels comes down automatically lower side because of the infestation by this malarial parasite. So they need to really have to reduce the dose of diabetic medication. And same thing will happen for blood pressure. Then BP medicine might have to be stopped temporarily. So these are the few points a person need to take into consideration. And the most important point, do not self-medicate, at least go to a doctor and treat yourself.
Right. And so you would suggest that stop Googling and just immediate consult a doctor, right? Because
Absolutely, because nowadays that
right, that's the easiest thing that
Google
people
is absolutely, they have been doing it. So because Google will not your clinical profile. Google will give you a brief idea in general. So
right.
everyone has got a different reason and different underlying mechanisms. So you need to visit the doctor. Your doctor can understand your illness better and can treat you accordingly. Thank you.
Right. So, Dr. Ketan, is there any specific test for getting detected with a malaria?
Yes. So there are, if you ask me, there is a simple test which can be called as peripheral smear for malarial parasite. So it is by a single finger prick, a drop of blood taken. You must be knowing, like for sugar, they check it on a glucometer. So similarly, you require just a drop of blood, and that is put it on a slide and seen under a microscope, you can detect. And that is still, as of now, the gold standard to detect malarial parasite. So it gives you two different information. One is first, there is a presence or absence of malarial parasite. And second, it can also tell what variety of malaria it is there. So there are two common varieties. One is Vivex malaria and second is falciparum malaria. So it can also detect. So that smear is like the absolutely clear-cut vision under which the malarial parasite have been identified. So that is the gold standard. Of course, there are other tests also. Like you have malarial antigen test, which is done from a blood, a routine CBC, which is done. But smear for malarial parasite, which is the gold standard for diagnosis of malaria.
Okay. Is there any chance of malaria getting relapsed again?
Oh, yes, a very important question. Now, people start having a recovery within 3 to 5 days.
Right.
And most of the time, people will feel that they have cure. But you must remember the Vivex malaria has got their extra erythrocytic phase, means that's a separate way by which they can stay in the liver for a prolonged period of time and can come back, make it their entry back in your body within few days to weeks. So there is something called as radical cure of malaria. The person has to take a therapy which is different from curative therapy. So one is the curative therapy and second is the radical cure, which is with primaquine. And the people who don't take this therapy, they are likely to have a relapse. It is not because of the second mosquito bite. It is because the previous infestation with the parasite has not totally cleared from the body. And that is why it can come back. That is one. And second is, if you are residing in an area where there are ample of mosquitoes, so you had one interaction with them, it doesn't mean they cannot come. It is like a guest coming to your place this year might come back next year also.
True,
So you
very
will
true.
see them coming again. In fact, the people who has got it, they have
More
definitely
likely.
most vulnerable. And these are
Right.
the people who are more vulnerable to get the recurrent episode also. So they need to be careful, improve their surrounding hygienes. Thank you.
Thank you so much, Dr. Ketan, for coming to our show, sharing your valuable time and insights with us, and sharing this significant information with our viewers today. Thank you so much. It was a pleasure having you on the show.
Pleasure is mine. Bye, sir.
Thank you. Thank you, Dr.
Thank you.
Ketan. Please
Thank
take
you.
care and have a good day.